morning. My name is Stephanie Polk. I'm a nurse practitioner student. This morning I'll be performing a physical examination on AM. We've already gone over a thorough health history. She's a 27-year-old female. She's alert and oriented to person, place, and time. She is well nourished with no obvious deformities or barriers to this exam. We've taken a set of vitals, and her vitals are blood pressure is 116/72, pulse is 78, respirations are 17, and temperature is 98.6. Her height is 5'5", and her weight is 165. Her oxygen is 98% on room air. And for the sake of the exam, we will be performing all tests on just one side of the body for sake of time. So we'll begin the test. Do you have any questions or concerns?
No.
Okay, would you like a blanket?
No, I'm okay.
Okay. Well, if any time during the test or exam you have any questions, just stop me and let me know, okay?
Okay.
I've washed my hands previously to the exam as well. So what we'll first do is we're just going to start off with a general survey, specifically of the head and neck and the skin on the body. All skin is even. Skin appears all to be intact with no lesions, no scars or deformity. Skin is all equally warm. She has no edema noted, no other obvious issues with her skin. We're going to do a quick assessment of the head and neck as well. So head is sitting midline to the body. She has no obvious issues on the face, no scars or lesions as well. I'm just going to palpate on your head, okay? Okay, so no lesions, no masses, no issues with the scalp. The scalp is intact. The hair is evenly distributed. The scalp does not have any flakiness or issues with that as well. She has no issues around the neck. The skin is appropriate to the patient's ethnicity. The skin on the face is appropriate as well. Her eyebrows are even and have good hair distribution throughout. The eyelashes also sit appropriately and distributed throughout the eyelid. I'm going to just poke right here, okay? Okay, any tenderness felt right here?
No.
Okay, any tenderness here?
No.
All right, so I'm just palpating the sinuses. So I'm going to palpate right here, which is the frontal sinus. Any pain?
No.
Okay, how about right here?
No.
Okay, so no tenderness noted in the frontal or maxillary sinuses. Okay, so all facial features are symmetric. The nasolabial folds and the palpable fissures are intact and even as well. The lips are well perfused. They are pink and moist. The ears sit symmetrically as well. Next, I'm just going to take a look at the trachea, which does sit midline. Any tenderness here?
No.
Excuse me, I'm just going to press to the right and to the left. Do you have any tenderness there?
Mm-mm.
Okay, great. So no scars or lesions noted here, and no obvious issues with the trachea as well. So I'm just going to palpate a few things. You just let me know if you have any issues or any pain or tenderness, okay? So I'm just going to palpate the lymph nodes here. So I'm going to start with the pre-auricular, the posterior auricular, the occipital, the tonsillar. Any pain?
Nope.
Okay. The submandible or mandibular, the submental, and the anterior cervical, the posterior cervical, and then the supraclavicular. Any pain or tenderness?
No.
Great. Okay, so no nodes were felt, no pain or tenderness noted as well. Good. Okay, now I'm just going to walk around the back. I'm going to palpate your thyroid.
Okay.
Okay, I'm just going to have you lean your head forward just a bit, and then I'm going to ask you to swallow, okay? Okay, you'll just flex your head forward, and then swallow. Any pain or tenderness?
No.
Okay, great. So the thyroid did rise evenly, and no nodules or goiters were felt at that time. Now, during this exam, I'm going to be testing a few of your cranial nerves through each body system. So first, we're going to start with a few to do with your eyes, okay? So the first one we're going to do is cranial nerve number 5, which is the trigeminal. So first I'm just going to have you open and close your mouth, and then clench your teeth. Okay, and then I want you to frown. Good, and puff out your cheeks. Okay, great. And then I'm going to just try to open your eyelids. So if you'll close your eyes, and don't let me open them. Okay, perfect. So cranial number 5, the trigeminal nerve is intact. So then we're going to do, you can open your eyes, cranial nerve number 7, which is facial. So I'm going to just have you raise your eyebrows. Good. And then I'm going to have you, she's totally messed that up. Okay, so that's cranial number 5. I'm going to start the cranial nerves over again. So cranial number 5 is the trigeminal. So I just want you to clench your teeth together. Okay, and now I'm going to want you to move your jaw side to side against resistance. Good. Now I'm going to test a few things just along your face, okay? So this is sharp for the sake of this test, and this is dull. Okay, so up here, sharp and dull. So I'm going to have you close your eyes, and when I touch your face, just let me know if it's sharp or dull, okay?
Sharp.
Good.
Dull.
Good.
Sharp.
Perfect. Okay. And I'm going to do one other test real quick. I'm just going to lightly touch your face. Just let me know when you feel this.
Okay.
Close your eyes.
No.
Good.
No.
Good.
No.
Okay. So I'm going to test one more thing. If you'll just look off in the distance, I'm going to test for your corneal reflex. Okay. Okay, great. Which is intact. So cranial nerve number 5, again, is trigeminal, and motor and sensory function are both intact for that. Now I'm going to try cranial nerve number 7, which is facial. So I'm going to have you raise your eyebrows, and then frown, or smile and frown, and puff out your cheeks. Excuse me. Okay, so cranial nerve number 7 is intact to motor. All right, next we're going to test a cranial nerve number 11, which is spinal accessory. So I'm just going to place my hands on your shoulders. Excuse me, and I want you to just try to rise against my arms, okay? Good. Okay, now if you'll just press against my hand. Perfect. Okay, great. So cranial nerve number 11 is intact. Now we're going to move on to your eyes. Okay, so what we're going to do now is just a visual inspection of the eyes themselves. So the eyes are appropriately situated on her face. The eyes appear to be in the socket correctly. They're not sunken in or any protrusion noted. Like I stated, the eyebrows are even, the eyelashes are appropriate. I'm going to just press down on your eye here, okay? And then if you'll look down. Good. So the conjunctiva is pink under the lid and white over the sclera. Any tenderness?
No.
Okay, so I'm just going to feel here for the lacrimal apparatus. Okay, and I'm unable to palpate through the lacrimal apparatus. So no pain there?
No.
Okay, great. Now I'm going to do a couple of visual tests. The first one we're going to do was just going to check your peripheral vision. So I'm going to wiggle my finger starting behind you and working towards myself, and I just want you to tell me when you see my fingers, okay? Great.
Now.
Great.
Now.
Great.
Now.
Awesome. Okay, so her peripheral vision is intact. Now I just want you to follow my finger, okay? Okay, and then just follow my finger just with your eyes. Okay, wonderful. Now I'm just going to take a quick peek with my pen light. Grab my pen light. Alright, so I'm just going to have you look just right over my shoulder, okay? Wonderful. And for the sake of this exam, we would normally dim the lights in the room. For now, we're just going to keep it like that. So all of my tests indicate that the cranial nerve number 3, 4, and 6, which is the oculomotor, trochlear, and the decussans, are all intact. Your pupils are the appropriate size at 3. There's no deviation in either pupil. The pupils are equal, round, and reactive to light and accommodation. The pupillary movement is equal directionally and consensually. Okay, I didn't notice any nystagmus or extraocular movements or fluid. So those are cranial nerves 3, 4, and 6. All of those are intact. The next test that we would perform would be testing cranial nerve number 2, which is the optic nerve. So prior to our physical assessment, we performed 2 visual tests. We did the Snellen chart, and for the Snellen chart, she was 20/20 in the right eye, the left eye, and both eyes. And then we did a near vision acuity test, and she was 14 out of 14 on both the right, left, and both eyes. Now I'm just going to take a look inside your eye. Okay, so first I'm going to test for the red reflex. So if you'll just look over my shoulder, okay? Okay, so the red reflex is present. Okay, so I'm going to just take a quick look inside, okay? Okay, so I'm just going to follow the red reflex in. Good. Okay, so arteries and veins are present. The optic disc is present, and it's a creamy yellow. There are tight margins. I see no cloudiness or white spots on the retina. And if you look directly in the light, okay, the macula and fovea are not seen for this exam. Okay, great. Okay, now I'm just going to take a quick look at your ears. Excuse me. The ears are both symmetrical. All external landmarks are present. There's no edema noted. There's no redness or discharge noted. Do you have any pain when I palpate?
No.
Around there? Okay, great. I'm going to take a quick look inside your ear, okay? Okay, I'm just going to pull the pinna up and back. Let me know if you have any pain, okay? Okay. So the tympanic membrane is visualized. It is a pearly gray. I can see the bones of the inner ear, the umbo and the malleus. The tympanic membrane is intact, no redness, no discharge. That looks good. No pain with that?
No.
Great. Okay, so now we're going to do a few more tests. These are going to be testing a few more of your cranial nerves. The first one we're going to do is cranial nerve number 8, which is the acoustic nerve. So if you'll just occlude your left ear, I'm going to walk behind you and whisper a word, and I want you to tell me what that word is, okay?
Okay.
Okay. Pumpkin.
Pumpkin.
Perfect. Okay. Now what I'm going to do is I have a ticking watch on right now. So I'm going to place it over your right ear. Just let me know when you hear the ticking, okay?
Okay. Now.
Perfect. Okay, great. Now I'm going to do a few other tests. So high-pitched and whispered words are heard. This is called the Renee test. What I'm going to do is I'm going to hit my tuning fork. I'm going to place it just on, behind your ear. And you're going to hear some noise when I place it back here. I want you to tell me when that noise stops as I've got it placed here. Then I'm going to move it forward, and I want you to tell me when the noise stops as well, okay? Very loud. Sorry.
Okay.
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 Good. Okay, so the Renee test is good. She's got longer conduction through air than she does on the bone, so that's a good indication that her hearing is intact. I'm going to now place the tuning fork on top of your head. This is the Weber test. I want you to tell me if you can hear that sound equally in both ears, okay?
Yes.
Perfect. Okay, so cranial nerve number 8 is intact, and bilateral hearing is intact as well. Okay, so now we're going to move on to the nose. The nose is midline. There are no obvious deformities or issues with that, no deviations seen on inspection. And if you'll just occlude one nostril and breathe in, and then the other. Good. Okay, so both nostrils are patent with no issues seen. I'm going to do a quick look inside, okay? Okay, so the turbinates are visualized. They are pink and moist. There's no discharge, no masses, no redness or swelling. The septum does appear to be intact with no deviation. So that's good. Now I'm going to test one other cranial nerve while we're here, cranial nerve number 1, which is the olfactory nerve. If you'll close your eyes for me, I'm going to place a smell in front of your nose, and I'd just like for you to identify that smell, okay? Excuse me.
Alcohol.
Perfect. Okay, so cranial nerve number 1 is intact. And we're going to move on to the mouth, okay? So I'm just going to take a quick look. The mouth is appropriate. The lips are pink and moist, which shows good perfusion. We're going to look inside. If you'll just take a quick perfect. Okay, one more time. Good. Grab my pen light. Okay, so buccal mucosa is intact. It is pink and moist. Just stick your tongue out for me. Open up. Here we go. I'm just going to take a look at your tonsils. Say Good. So tonsils are good. There's no white patches or any exudate noted. Tonsils are 1+. The uvula did move up and down midline, and the pharynx is also intact, which is appropriate. Any pain?
No.
Okay. The teeth also are clean. They're intact. There are no obvious signs of any dental caries. And so now we're going to test a few more cranial nerves, okay? So we're going to test cranial nerves number 9, 10, and 12, which is the glossopharyngeal, which is 9, 10 is the vagus, and 12 is the hypoglossal. As you said, I saw the uvula move up and down, which indicates that cranial nerve number 9 is intact. Also, cranial nerve number 10, you'll stick your tongue out. Perfect, if you'll move it side to side. Okay, great. And the tongue is pink and moist. The ventral portion is also pink, it's moist, it's vascular, which is appropriate as well. There are no lesions or wasting noted. So cranial nerves number 10, the vagus and a hypoglossal are intact. I'm going to check a gag reflex to check 12 or 10. Good. Okay, and 12 is the tongue protruded midline. Could see that cranial nerve number 12 was intact as well. Okay, any questions so far? Okay, at this point in the exam, I'm going to give you 3 words to remember, okay? And later on in the exam, I want you to recall those for me. So the 3 words that I'm going to tell you are pumpkin, orange, and ball. Okay, can you repeat those for me?
Pumpkin, orange, and ball.
Perfect. Okay, great. So now what we're going to do is just move on. We're going to do I'm going to listen to you, I'm going to inspect your chest, and all of that. Are you comfortable still? Mm-hmm. Not too cold or warm?
No.
Okay, great. So right now I'm going to have you just turn a little bit this way for me. Perfect. So what I'm going to do is just take a quick look at your back. I'm going to inspect the back for any lesions, any retractions. If you'll take some good, slow, deep breaths for me. Good. I'm going to pull your shirt up just a little bit here in the back. Great. You having issues breathing?
No.
No pain?
No.
Okay, good. Okay, so the posterior chest, the skin is appropriate for her ethnicity. There are no scars or lesions, no redness noted. Do you have any tenderness as I palpate back here?
No.
Okay, good. So no costovertebral angle tenderness. I'm going to place my hands on your back. If you'll take a good deep breath in for me. Good. Okay, so chest expansion is symmetrical. And what I look at my patient here, her transverse versus AP ratio is appropriate. The AP ratio is less than the transverse. Now I'm going to do a little percussion, okay? Okay, and as I percuss, I hear resonance throughout, which is an appropriate finding. Now I'm going to do something called the diaphragmatic excursion. I'm going to have you breathe in and out and make a few marks. My ruler here. Okay, so if you'll take a deep breath in, okay, and hold it. Okay. Perfect. Okay, now I'm going to have you take a deep breath in, exhale, and hold it for me, okay? So deep breath in and exhale. Perfect. Okay, you can breathe normally. So I'm just going to measure for diaphragmatic excursion, okay, which is about 3 centimeters, which is also an appropriate finding. Now I'm just going to palpate, and when I palpate and press my hand on your back, if you'll say a couple things for me, okay? So the first one is 99.
99.
Okay.
99. 99.
Great. Okay, so no increase or decrease noted with that frenitus, so which is a normal finding as well. And we noted that there was no tenderness along the vertebral line as well. Correct? No pain there?
No pain.
Okay, fantastic. All right, so now I'm going to listen to your lungs, okay? Okay, so when I place my stethoscope, I'm just going to have you breathe in and out normally, okay?
Sure.
Good. Okay. Great. Okay. Okay, perfect. Now this time as I place my stethoscope over your back, I'm going to have you say the word 99. Okay? Okay?
99.
Great.
99.
Good.
99.
Perfect. Okay, so all sounds were muffled, which is an appropriate finding. Now I want you to whisper the word 99, okay? Okay? Okay, perfect. Again, 99 was not heard throughout the lung fields, and that is an appropriate finding. Now I just want you to say E every time
E.
Good.
E.
Great.
E.
Okay, good. So I was able to hear E throughout all of the lung fields, which is an appropriate finding. So there's no bronchophony, hectoriliquy, or egophony heard, and then there are all the secular sounds heard in all of the lung fields, which is an appropriate finding as well. Get this in for you. At this point in the exam, we would do a breast exam for females, but we're going to defer that for the sake of time in this assessment. But what I would do with my patient is I would have her lay supine with her hands above her head. And what I would do is I would check the breast. I would do a good inspection. I'm going to look for anything abnormal, such as any dimpling, any retractions of the breast tissue, if I noted any irregularity in the nipple. And then I would take my second, third, and fourth finger pads, and I would begin to palpate, excuse me, a light, medium, and deep pressure using a circular motion. And I would do a longitudinal exam where I would start from mid-axillary line over to the mid-sternal, and then from the clavicular line down to the bra line. I'm just going to examine again. After I do this, I'm going to examine for the consistency of the breast tissue. I'm going to note any tenderness or any nodules that I might feel. I'm also going to examine the nipples for any discharge, any flaking or irregularity or inversion. And then I'd have my patient sit up. I'd ask her to lean forward, and I would visualize both breasts looking for symmetry as they hang. And then we would lift the arms, and we would be able to examine the cervical, axillary, and the clavicular lymph nodes and look for anything at that point. Any questions so far?
No.
Excuse me. All right, so next what we're going to do is we're going to do a few cardio assessments, okay? So first what I'm going to have you do is just lay back here. Okay. Okay, good. Perfect. All right, move that pen. So first what I'm going to do is just a general inspection. I'm going to palpate the point of maximal impulse, which is just below here at the apex. Okay, any tenderness there?
No.
Okay, so point of maximal is felt. So no pulsations, heaves, or lifts. I could also check an apical pulse at this time, but for the sake of time, we're going to defer that as well. So I'm just going to take a quick look for any obvious issues, no thrills or anything like that on the abdomen. I don't see anything, but excuse me. Any pain or anything?
No.
Okay, great. So I'm going to take a quick look and listen, or a quick listen. I'm going to auscultate the 5 different areas of the heart. Okay. All right. So first we're going to start at the aortic. You can just breathe normally, okay? Good. The pulmonic. the tricuspid, and then the mitral. Good. Okay, so no abnormal heart sounds heard. Now I do the same listening with the bell. Awesome. Okay. So next I would auscultate for any bruits that I could hear. So I'm going to start with the temporal. Good. Then the aortic. The carotid. Good. And then we're going to listen to the aortic. Good. The the renal. The iliac. And then the femoral. Excuse me. Okay, great. Okay, so no bruits heard throughout. Okay, so next what I'm going to do is just look at the peripheral vasculature and examine all extremities. So all extremities appear well perfused with good skin color noted, good temperature, no pain or anything?
No.
Okay, great. I'm going to just lift this leg. Do you have any calf pain?
No.
Okay, great. So I just dorsiflex this foot. Any pain in this calf?
No.
Great. So that's the Homan's test to check for any DVTs that might be present. So the Homan sign is negative on our patient or my patients. I'm going to check capillary refill. Good. Okay, nice. So capillary refill is less than 2 seconds, which is an appropriate finding for both extremities. Okay, have any pain or issues? Okay. Now I'm going to take a look at your pulses and just palpate your pulses, okay? Mm-hmm. Excuse me. All right, I'm going to check for temporal pulse, a carotid, excuse me. Mm-hmm. Okay, and the brachial, radial, and then the femoral. Good. And then I'm going to do the popliteal. Good. And if you straighten that leg out for me. And the dorsalis pedis. And then the posterior tibial. Okay, great. All right, so all pulses were 2 to 3 plus, which is a normal finding as well. All right, so while you're laying back, I'm going to take a look at your belly, okay? Put these together for my ruler's under there somewhere. Okay, perfect, you're good. Got it? Yeah. Okay, so first I'm just going to do a quick inspection of the abdomen. Okay, so the abdomen, the skin is an appropriate color. There are no obvious deformity, no masses or pulsations noted, no hernias noted, no pain or tenderness that you've had.
Nope.
Okay, great. There's no blue around the umbilicus, which is a negative colon sign. This is very symmetrical. I'm going to listen to all of your, I'm going to listen to your belly, okay? Good. 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 Okay, great. So I'm just going to percuss over your belly, okay? Okay, great. So Tiffany's hurt throughout the abdomen in all 4 quadrants with a little bit of dullness towards the edge of the liver over the gastric bubble as well. Now what I'm going to do is I'm going to walk over here and I'm going to do something called a liver scan, okay? So you can just breathe normally for this exam, okay? So what I'm going to do first, I'm just going to palpate. Measure. So the liver span is about 5 centimeters, which is an appropriate finding. Okay, so now I'm just going to do a little bit of palpation, some light palpation, and then deep. If you have any pain, just let me know, okay? I'm also going to assess to see if I can feel your liver and your spleen, okay? Any pain?
No.
Okay. Any pain there? I'm going to try to assess for your liver, so just take a deep breath in, okay? The liver is not felt. Any pain?
No.
Okay. Okay, I'm going to try to assess your spleen, so if you'll take a deep breath in and out. Okay, so the spleen is also not able to be felt. Now if you'll take a deep breath in, I'm just going to press in. And let me know if they have any pain there. Just deep breath in. Okay, and out. Good. So she's able to continue with inspiration as I push at Murphy's point. So that's a negative Murphy sign. Okay, now I'm going to press right here. You let me know if you have any pain, okay? Any pain?
No.
Okay. So no pain noted with rebound tenderness, which is Bernie's test. So that's a negative sign as well. Now what I want you to do is I'm going to have you sit up, okay? I'm going to have you just jump down, and if you'll just raise up on your toes and slam down. Do you have any pain with that?
No.
Okay, so it's a negative Markle sign. What you do is just walk to the edge of the room, just using a regular walk. Okay, great. And if you walk back to me, heel toe. Perfect. That's great. Now what I want you to do is just close your eyes, okay? So for the sake of this test, we're looking at the Romberg test. I see no swaying. We would do this for 60 seconds normally, but for the sake of time, we're going to defer that. So I saw no swaying or anything like that, so she has a negative Romberg's test. Now I'm going to get you to turn this way. Just doing a general inspection of her musculoskeletal system. I see no obvious deformities. As she was walking away from me and then back to heel toe, her gait is appropriate. It is fluid. She's able to stand upright with a correct posture. I see no signs of any muscle atrophy. The iliac crests are symmetrical, as well as the scapula and shoulders. I'm going to just press over your spine or vertebrae. Tell me if you have any pain, okay?
Okay.
Any pain?
No.
Now I'm just going to lift your shirt up and have you bend over and touch your toes, okay? Good. Any pain?
No.
Okay, great. You can come back up. Okay, so no signs of scoliosis are noted, and no deviations of the vertebrae along the spine itself. If you'll turn this way for me, I'm going to do a couple other tests. No pain or any issues in your shoulders, the joint itself. No pain in your neck?
Nope.
Okay, great. So this time, will you just turn your head right and left, and then back to front? Okay, no pain with that?
Nope.
Awesome. If you'll just press against my hand. Good. Okay, so the neck shows full range of motion and strength in that joint as well. The shoulders have no pain. There's no obvious redness, no swelling or edema noted, no pain. And now I'm just going to have you do a couple other arm exercises. If you'll just straighten your arms out, up above your head and down, behind your back, across your body. Perfect. Shoulders have good range of motion. If you'll push up against my arms. Okay, so don't let me push them down, and then down against my hands. Okay, so the shoulders are good strength as well. Now we're going to check your elbows. Do you have any pain in your elbows? Okay, so no thickening, no edema, no redness, no swelling, no lesions or scars noted on the arm. Okay, so now I'm just going to have you flex your arms, extend them. And with this one, I want you to try to pull away from me. Okay, and then push. Great. Okay, so full range of motion and strength noted in the elbows as well. Now we're going to look at your wrist. Any pain?
No.
Okay. No swelling at the joint. There's no edema, no lesions noted. You'll just flex your arm a couple times. Rotate your arm. Good. So full range of motion noted in the wrists as well. How about your fingers? Any pain?
No.
No pain in the joints? Good. If you'll just wiggle your fingers in and out. You'll just try to, don't let me close your fingers. Okay, and then open them against it. Perfect. Okay, so there's full range of motion in the wrists and all fingers with good and adequate strength. Now we're going to do a couple tests for carpal tunnel. Okay, so the first one, excuse me, that I'm going to have you do is the Tennell's test. I'm going to just tap on your arm or your wrist. Any pain?
No.
Okay, great. So it's a negative Tennell's test. The next thing we're going to do, I'm going to have you put your hands like this. You would press your wrists together. And we'll do this test for 60 seconds. But again, for sake of time, we're going to hold that for just a second. Any pain with that?
No.
So that's a negative Tennell's test. Now if you'll just hold your hand out, and I'm going to abduct this thumb. Hold it against resistance for me. Okay, good. Okay, so no pain present as I abduct that finger or the thumb. So all of these tests show me that with thumb abduction, Tennell's and Phelan's, that there's no carpal tunnel noted. Okay, so all upper body extremities all have good range of motion with muscle strength of 4 to 5 throughout. Now I'm going to have you lay back down for me. Okay, still don't need a blanket?
No, I'm good.
All right. So now we're going to do a couple range of motion of the hips, knees, ankles. Okay, so no pain?
No.
Okay, we'll just straighten those legs out for me. Okay, so no pain in the hips.
No.
Okay, so there's no redness, no swelling noted at the hip. Okay, if you'll just push against my hand. Okay, other side. Okay, good. So good range of motion and strength noted in the hip. Same thing with the knee. You'll just bend against my, okay, other way. Okay, no pain with this? Okay, great. We're going to take a look at your ankle. No swelling noted at the ankle or at the knee. There's no edema, no pain.
No.
Okay, they'll just flex and extend. Rotate your ankle as well. Perfect. Okay, now with the toes. No pain in the toes?
No.
Awesome. You'll just wiggle your toes for me. Okay, perfect. Now what I'll ask you to do is just put your chin to your chest. Okay, there's no pain with that?
No.
Okay, so no pain or nuchal rigidity noted. And as we were doing this test, I did not see any flexion in the hips or knees, which shows me that that's a negative Kernig sign. And with no pain elicited with the nuchal rigidity, that's a negative Rudensky as well. Now I'm going to do a couple of tests that we could assess for any hip or knee pain that a patient may have. But since my patient doesn't have any pain, we're just going to show you what those tests would be. The first is the straight leg raise. And what we'll do here is we'll just raise this leg. Excuse me, if the patient had any pain, I would raise the leg to the point where there was any pain and then just lower it a bit. I would dorsiflex the foot. No pain there?
No.
Okay, great. So that's a negative test. With no pain there, that's a negative Braggart's test. On the straight leg test, no pain in your knee?
Nope.
Okay. So if there was any knee, I could just push, or knee pain, we could do a series of a few tests. I'm going to feel and push around the patella. This is the ballottement test, and I don't notice any ballotting, which is there's no fluid in the knee or the patella area. So that's a negative ballottement test. The next one is called the McMurray's test. And for this test, we're just going to look to see if there's any meniscus effusions or any issues with this knee. So what I'm going to do now is I'm going to pull this leg up, and I'm going to push this away. Back here. Good. Good. So any pain with that?
No pain.
Okay, so I don't feel any click. There's no tenderness. So that's a negative McMurray's test. Another test that we could do if the patient was complaining of any pain would be the valgus test, which is going to assess for the medial ligament, so the MCL. So what we would do with this one is we're just going to push the knee laterally and turn the ankle medially. Do you have any pain?
No.
Okay. And then the opposite is the varus test, which is going to test the LCL, which is the lateral ligament. Pain with that?
No.
Okay, good. So both the medial and the lateral ligament are intact. So then the next one we could test for is the anterior drawer, which is going to test for the ACL. So what we would do here is just, if you'll bend that knee for me. Excuse me. Now I just want you to tell me if you feel any pain when I pull on your leg.
Okay.
Any pain? Okay. So I didn't feel any sliding noted in this. And then the next one we do is the posterior drawer. So I'm just going to push. You let me know if you feel any pain.
Okay.
Okay, and this is going to assess the posterior ligament as well. So no pain noted there. And the last one we could check, or the next one we could check, is the Lockman test. So I'm going to just stick the knee and look for any forward excursion of the knee. Any pain?
No.
Okay, good. So that's a negative Lockman's test. And then if the patient needed to, she had larger thighs, we could actually turn her on the side, which would be a prone Lockman's test. That way the bed would support the femur, and we could perform the test that way for a prone Lockman's test. Okay, just a couple more things, okay? So I'm going to have you sit up for me. Okay, so the next one is the seated leg raise. We're just going to test to see if you have any pain. Any pain there?
No.
Okay, good. Okay, so that's negative for a seated leg raise. Next, I'm just going to try to look at your knee to see if I see any fluid as I push. Okay, any pain?
No.
Okay, so no fluid noted or a bulge sign on this test. Okay, so that concludes the musculoskeletal assessment for my patient. And next, what we're going to do are just a few more things. Remember earlier I asked you to remember a couple words for me?
Yes.
Okay, can you recall those words for me?
Pumpkin, orange, and ball.
Perfect. And how about your date of birth?
10/7/87.
Who's our president?
Obama.
Great. So both recent and remote memory are intact. Now I'm going to ask you just to do a series of tests for me. If you put your hands on your thighs and just move them rapidly. Great. And if you'll touch your thumb to your fingers rapidly. Okay, perfect. So rapid movement is intact. You'll just follow my finger or touch your nose and then touch my finger. Okay? Perfect. Okay, wonderful. Now I'm going to do a couple of sensory tests. The first one we're going to do is the same as we did earlier, which is the sharp dull test. I'm just going to do those on your extremities, okay? So just so you know, this is dull.
Okay.
And this is sharp.
Okay.
Okay? So close your eyes for me.
Sharp. 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 Dull.
Good.
Dull. Sharp.
Okay.
Dull.
Perfect. Now I'm going to place 1 or 2 sides of this on your arm, and I just want you to tell me if you feel 1 or 2 points, okay? Okay.
1, 2, 1, 2, 2, 1.
Awesome. Okay, great. Now, same thing. I'm just going to press this cotton ball along your arm. If you'll just tell me when you feel it, okay?
Now.
Perfect.
Now. 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 Now.
Okay, wonderful. You can open your eyes. I'm going to place an object in your hand, and I want you to just tell me what that object is, okay? So if you'll close your eyes.
Keys.
Perfect. Okay, so stereognosis is intact, as well as 2-point and 1-point discrimination, and light touch and sharp and dull touch. So I'm going to just do this, and you can see that this is vibration, and I just want you to tell me when you feel the vibration, okay?
Now. 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 Now.
is intact as well. Okay, now we're just going to test a few reflexes, okay? All right. So first we're going to start with the biceps. You go, just relax your arm for me. Okay. Okay. And then the triceps. Okay, and then the brachioradial. Great. And then I'm going to look at the patellar. Ready? Okay, perfect. Now I'm going to look at the Achilles. Okay, and then the plantar. Good. Okay, so the toes can flex with that. Okay, so all of my reflexes are intact. All reflexes were 2 plus throughout. And so this completes our exam, our head-to-toe assessment. If we were doing an assessment on an infant, we could do an Ortolani maneuver test. And for that test, I would place the baby supine, facing the examiner on the table. I would flex the legs to form right angles with the knees. I would then abduct both legs simultaneously until the lateral aspect of the knee was on the table. If I were to feel any movement or hearing any clunking or clicking sounds, that would be a positive sign indicating that the femoral head was moving back into place. So that would be a positive test. Okay, if you have any questions or concerns for me?
Nope.
Awesome. This concludes our exam for today.
Great.
Great.